Right now, some of the most expensive prescription drugs in America are suddenly being advertised for as little as $199 a month, down from prices that often exceeded $1,300. Tonight, we're seeing the launch of what's being described as one of the most ambitious healthcare pricing initiatives ever introduced. Supporters say there's never been anything like it. Starting now, dozens of widely used prescription medications are being promoted at steep discounts through a new government-backed website called TrumpRX.gov. That's TrumpRX.gov. But here's the real question. Will this actually lower what you pay at the pharmacy? Or is this mostly headline pricing that won't change your out-of-pocket costs? Because once you understand how this system really works, you may look at your next prescription bill very differently. What is TrumpRX? TrumpRX is a new, government-supported website that lists discounted prices for prescription drugs. But there's an important detail many people miss. It does not sell medications directly. Instead, the site works as a central hub. You search for a drug, and the website either redirects you to the manufacturer's direct purchasing platform or provides a coupon that you can print or show at the pharmacy. So think of TrumpRX less like an online pharmacy and more like a referral and coupon system. At launch, around 40 branded medications are listed. These come from the first 5 pharmaceutical companies that signed pricing agreements with the administration, including AstraZeneca, Eli Lilly, EMD Serono, Novo Nordisk, and Pfizer. More companies have agreed to participate, but not all of their medications are available yet. And this connects to a much bigger issue. Why was TrumpRX created? TrumpRX is built around a policy concept called Most Favored Nation pricing. The idea is simple. Americans often pay 2 to 3 times more for the same prescription drugs than patients in other developed countries. The argument is that U.S. consumers have effectively been subsidizing lower prices overseas. Under this approach, drug makers are pushed to match the lowest prices they charge in comparable countries. Last year, pricing agreements were negotiated with 16 major pharmaceutical companies, and TrumpRX is meant to be the public-facing result of those deals. Here's how the numbers look on paper. Ozempic listed between $199 and $350, down from roughly $1,000. Wegovy injections as low as $199. Instead of about $1,349. Zepbound reduced from over $1,000 to around $299 to $346. Fertility drugs like Gonal F cut by more than 80%. Significant list price reductions on insulin, inhalers, and certain specialty medications on the surface. These are dramatic price cuts. But this is where things get complicated. Who actually benefits? This is the part that matters most. The majority of Americans get their prescriptions through insurance, Medicare Part D, employer plans, Medicaid, or private coverage. In those cases, patients usually pay a copay, not the full list price. Here's the key detail. TrumpRX purchases are typically cash pay. That means you may have to pay fully out of pocket. The purchase may not count toward your deductible. It may not count toward your out-of-pocket maximum. Health policy experts are already questioning whether these purchases can legally be applied to insurance deductibles at all. So if your insurance already gives you a $30 copay, paying $199 cash through TrumpRX could actually cost you more. When TrumpRX could help, there are situations where TrumpRX could make a real difference. You may benefit if you are uninsured, you have a very high deductible, your insurance doesn't cover a specific medication, you use weight loss or fertility drugs that many employers exclude, your plan excludes certain specialty medications. For example, while Medicare is expected to begin covering weight loss drugs later this year, many employer plans still do not. If you're currently paying $1,000 or more out of pocket for a GLP-1 medication, a price of $199 to $299 could be meaningful. Dr. Mehmet Oz, now leading CMS, has advised Americans to at least check TrumpRX before buying. That advice makes sense. But checking prices and actually saving money are not the same thing. What experts are saying, this is where opinions diverge. Some health economists argue that TrumpRx is more about branding than structural reform. Insurers already negotiate substantial behind-the-scenes discounts, often 40% to 75% off list prices. That means the discounts displayed on TrumpRx may look dramatic compared to sticker prices, but insurers may already be paying similar or even lower rates after rebates. Researchers at Georgetown University and the Congressional Budget Office note that Medicaid discounts often exceed 75% off list prices. So for many insured patients, additional savings may be limited. Critics also warn that bypassing insurance could weaken insurers' negotiating power. Supporters argue the opposite, that increased transparency could drive competition. The reality is, this isn't a simple win or lose policy. The impact depends heavily on your coverage. The bigger policy debate, TrumpRx is also part of a broader political battle over drug pricing. Democrats point to Medicare drug price negotiations under the Inflation Reduction Act as the better long-term solution. Some medications, like Eliquis and Jardiance, saw major reductions after being selected for Medicare negotiation. Trump's approach emphasizes international price matching and direct consumer access, and he's pushing Congress to codify these agreements into what he calls a broader healthcare reform plan. One critical issue remains unresolved. For TrumpRx purchases to count toward insurance deductibles, Congress would likely need to act, and so far, that hasn't happened. Big picture. Will this lower drug prices overall? Even as TrumpRx launches, broader pricing pressures continue. Drug manufacturers raised list prices on nearly 1,000 brand-name drugs this January, with a median increase of about 4%. Prescription drug prices are still rising faster than inflation in many categories. So while TrumpRx may help certain groups, experts agree it's unlikely to be transformational for most insured Americans, at least for now. Practical takeaway: here's what you should actually do. Check your insurance copay first, then check the TrumpRx price, compare both, including whether the purchase counts toward your deductible. Ask your pharmacist to run both options depending on your situation. One option may clearly be better, and this could change as more drugs are added. So here's the question for you. If you saw your medication listed at a huge discount, would you feel comfortable paying cash outside your insurance system? Or would you stick with the coverage you already know, even if the sticker price looks higher?